Welcome back to Fox and Friends. 17 minutes now past the hour. Well, how can you tell if your child is more than just a little overactive? Well, now there's a new test to help doctors identify attention deficit hyperactivity disorder. Dr. Manny Alvarez, member of the Fox News Medical A team, joins us now to talk about this. Dr. Manny, nice to see you.
Good morning.
So this is real progress, it sounds like, trying to figure this out, because a few years ago, we didn't even know that ADHD existed, or at least we thought it was made up.
We always knew that it existed, but basically the fundamental problem with missing the diagnosis is that this is an anecdotal diagnosis. You know,
right.
Your parents would say he's very hyperactive, or your teachers would say it. So there was no accurate tool. This is now a new tool they call the Quotient measurement system, which really now the doctors can really measure from a computerized perspective how hyperactive, what lack of attention does the child have.
So how does it work? I understand there's a computer, so that immediately ropes me into it. So there's a computer. How does this thing work, this test?
You know, what they do is they sit the child in front of this very boring type of computer, and he or she is basically following some prompter, and the software is very accurate, with about 90% accurate or so of making the diagnosis, because, you know, look, there's a different behavior between boys and girls. You know, boys that have ADHD are inattentive and they are hyperactive. Girls, on the other hand, are inattentive. They don't necessarily are hyperactive. So this software is able to tell both of those components of ADHD and therefore make the accurate diagnosis within a minute or two, by the way.
Really? Because the test can go up to 20 minutes.
20
within
minutes,
a minute or two,
within a minute or two, the software, the data is being captured. Of course, it's being analyzed by a central computer, then automatically creates a report. The psychologist or the doctor, the developmental pediatrician, then looks at that data and decides what kind of therapy.
So it becomes a baseline then for future treatment.
Absolutely.
And what sort of therapy options are available for these
multiple
kids?
There's behavioral therapy, of course. There's also medication many times that a lot of pediatricians choose to use. And then once you start a therapy, you can go back in 30, 40, 60 days and say, okay, is the medication working? Is it not working? Do we need to readjust it? Do we need to bring it down? So it gives you a tool that we didn't have before.
So you go back, take the test again. Now, I know a lot of parents out there this morning probably saying, well, oh, I got to get my kid on this computer. I need to go get him tested.
No,
is it experimental yet, or can they actually go out and get this test?
Well, no, they can get it. But I tell you, one of the messages in this, and we did it at foxnews.com in this story in particular, is that if you don't diagnose a child with ADHD and they're hyperactive and they have inattention, that's going to create problems when they get older. Issues with depression, poor performance in school, drug abuse, you name it. There are many, many consequences, from not getting the proper diagnosis of ADHD.
Well, you held my attention for the full 4 minutes.
Yeah, I know. You passed the test.
I passed the test. Dr. Manny Alvarez, nice to see you as always. Go to foxnews.com and check out that video as well, and you get more information on that. Thanks so much.
Thank you.
Coming up here on the show, more